Hi, Nurse Daya.
Hi there.
You have a patient waiting for you in room 201.
Okay, great.
His name is Joe Glargine.
Awesome.
He's 16 years old and is recently diagnosed with type 1 diabetes mellitus.
Okay, I will use the ADPI approach when working with him.
Perfect. He needs you to explain how to administer his insulin, to manage his blood sugars, and any tips and tricks to stay healthy with this new diagnosis.
All right, I'll head on in. Hi, Joe. My name is Daya Beatty. I'll be your nurse today. What brings you in?
Well, I was just diagnosed with diabetes, and I'm hoping to learn how to monitor my sugar levels, and I'm not sure what to do with all the needles and all that.
Great. Today is our first appointment, so we would like to get to know you better and provide some information to make this process more manageable for you. Is there anything else you'd like to discuss?
Not that I can think of now.
So I hear you're in high school.
Yeah, I go to Citadel High.
Cool. What's your favorite class?
I really like biology. I actually want to go into the Dalhousie 2-year nursing program when I graduate.
Awesome. I think learning about diabetes now will make you a more well-rounded nurse. What do you do outside of classes?
Well, I'm kind of tall, so I play basketball, but I'm not really sure if I can keep doing that or not.
Of course you can. There are just a few things to keep in mind that we will discuss later today. How are you feeling about having diabetes?
Well, I'm pretty confused. All I know is that it has to do with eating too much sugar.
Well, actually, you did nothing wrong to get this diagnosis. You have type 1 diabetes, which means that your pancreas doesn't produce any insulin, and insulin is a hormone that helps your body pull the sugar you eat into your cells so that you can use it to make energy. In your case, the sugar is staying in your blood, and this could lead to you getting sick. Since the sugar is all in the blood, it results in high blood sugar, and us nurses call this hyperglycemia.
So, I could get sick? Like a cold?
Not really like a cold. The signs and symptoms of hyperglycemia are frequent peeing, being thirsty, drinking a lot, blurry vision, weight loss, and feeling tired all the time.
Well, that just sounds like puberty.
Diabetes is actually serious over time if it's not managed properly. Some of the more serious side effects of long-term hyperglycemia are damaged nerves, which can cause numbness and tingling in the feet, eyesight issues, increased blood pressure leading to heart disease. But with the proper education and support from your interprofessional diabetes management team, we can help you stay healthy and manage your sugars to live a normal life.
Interprofessional what?
Interprofessional team. Your team is made up of many healthcare professionals such as nurses like us, dietitians who can help plan your meals and diet, doctors who can adjust your treatment and order tests to monitor how you're doing, and psychologists to help adapt to the challenges that come with diabetes.
Well, I feel like a celebrity. I guess you guys are kind of like my bodyguards then. Is there anyone else?
You'll get to know the pharmacist when you pick up your medications at the pharmacy, and they'll make sure that your insulin doesn't interact with any other medications.
Well, what do you mean, interact?
Well, you have to be careful with the substances you put into your body. For instance, people your age may start to experiment with alcohol. If you drink too much, this can actually cause your blood sugars to decrease, causing hypoglycemia.
If I have 1 or 2 drinks at a party, is that okay?
1 or 2 on occasion won't be dangerous, but we will connect you with your physician to give you more detailed information about the safety concerns around drinking alcohol. So back to hypoglycemia for a minute. It isn't just caused by too much alcohol, it can also be caused by not eating enough food, skipping meals, too much exercise, taking too much insulin, or other medications. If your blood sugar levels become too low and you become hypoglycemic, you may start to feel hungry, nervous, fatigued, shaky, confused, moody, dizzy, and you may start to get a headache.
Well, that makes sense.
If you start to feel like you're becoming hypoglycemic, you should test your blood sugars. Then if your blood glucose reading is less than 4, it is best for you to drink half a cup of juice or take 4 glucose tablets, and then reassess your blood sugar levels 15 minutes later. If you don't have juice or tablets on hand, you can eat a candy or a sugary snack instead.
Oh, okay, that makes sense. Except I'm a little confused because I thought insulin was going to help me.
The amount of insulin you inject into your body depends on the glucose readings. We can show you how to test your blood glucose right now. Okay, Joe, so here are the things you're going to need, your supplies that you're going to need to test your blood sugar levels. We have your glucometer here. We have an alcohol swab to sanitize. Your lancet, which will poke your finger to get the blood out to test it. Your gauze pad to wipe it off after. And your testing strip that will help you tell you what your blood sugar level is. So the first thing you're going to do is get it all set up. So we're going to put the strip into the glucometer. with this part sticking out, and you can see here that you're going to stick this onto the blood, and that will read it for you. So now that we have that ready, we're going to clean off your finger, and it's easier to test on the side of your finger. It's less painful to poke on that side. So you poke it, right there, you just click it in, and blood will come out. Now, you take your glucometer, and you just slip the blood onto it, onto the little line there. It'll soak the blood up, and then a number will come out. You can then take your gauze pad and wipe off any extra blood. All right, Joe, now you try.
Okay. I think it makes sense, but there's no blood coming out.
That's because you're made of polyvinyl chloride synthetic fiber.
If you were a real human, blood would bead onto your skin for the glucose test. If you have difficulty still, you could run your hand under warm water, hold your hand below your heart level for a few moments, or massage the tip of your finger. Since you are a teen between 13 and 18, it's best practice for you to follow the adult guidelines regarding maintaining your glucose levels. You want to keep your blood glucose levels between 4 to 7 before eating and 5 to 10 2 hours after eating. Your average blood sugar level over a 3-month period, called your A1C, should be less than or equal to 7%. We should add that you should pick up a notebook, or an easier way for you might be to download an app on your phone and record your glucose readings each time you measure. Your doctor will tell you how much insulin you need to inject in order to maintain the proper blood sugar levels.
Well, that makes way more sense. But how do I inject it?
We'll show you how. Here are your supplies to inject your insulin. You have your insulin needle, your 2 insulins, your short and your long-acting, your gauze pad to clean off the blood, and an alcohol swab to clean off the site that you're going to inject. So first you're going to take your insulin needle, and you're going to draw the amount of air into the cloudy that you need. You're going to draw air into the clear, and then you're going to draw the clear, and then you're going to draw the cloudy, and your doctor will tell you how many units to draw of each one. So once you have that ready, you're going to clean your site, wait for it to dry, and then you're going to pinch the site, and you're going to quickly insert it, take it out, and then clean the blood off. Can you show me how to administer yourself so I make sure you understand?
Definitely. Oh wow, that doesn't even hurt that bad.
Awesome, here are a few more tips. Make sure you have clean hands beforehand. Store your testing strips at the proper temperature between 2 and 30 degrees Celsius. Rotate sites on your abdomen to prevent complications. Eat 3 meals a day, spacing them 4 to 6 hours apart, while having a well-balanced meal and eating at the same time each day. Also, have a sugary snack on hand like the Dex-4 tablets or juice in case of emergencies like hypoglycemia.
Oh, hi, Dad.
You guys look so similar. We brought Joe up to speed on how to manage his type 1 diabetes. That being said, it is vital that you are able to help and support Joe through this transition.
Totally. I am just wondering if the supplies are all covered, as my medical plan is inactive because I am off on a disability.
You'll have to get in touch with your insurance provider, but here are some more resources, and we can put you in touch with a social worker as well. Interprofessional collaboration. We'll make sure the social worker also meets with Joe's teachers at school to fill them in on his new diagnosis and make sure they are flexible in this transition period. Is there anything you're unsure about?
Nope, that makes perfect sense.
Okay, we'll schedule a follow-up meeting with your interprofessional diabetes healthcare team in a couple weeks. Great.
Thank you.
Bye.